people actually can go outside and enjoy the beautiful weather. So welcome. Let's just go around really quickly and do introductions. I'm Renee Norton. I'm the Executive Director of the Mental Health Association. Erika?
Sorry, I was slow on the click off the mute. Erika Vesely, I'm the Community Response Coordinator with Rappahannock Rapidan Community Services.
Wonderful. Tanya?
I'm Tanya Klus. I'm with Department of Juvenile Justice.
Wonderful. Lori?
I'm Lori Parker. I'm the Director of Piedmont Dispute Resolution Center.
Ellen?
Ellen Chamberlain, Virginia Cooperative Extension.
Donna?
Donna Rogers from Morgan's Message.
Carolyn?
I'm Carolyn Lamb, and I coordinate Virginia Tiered Systems of Support for Behavioral Emotional Concerns for Fauquier County Public Schools.
Andy?
Andy Johnston, Senior Program Officer here at the PATH Foundation.
Perfect. Kyle?
I was a little slow off that too. Kyle Beck, I'm the Assistant Director of Fauquier Community Childcare.
Perfect. Bridget?
Bridget Downey, I'm the Administrative and Program Support Specialist at Mental Health Association.
Perfect. Thank you all so much for introducing yourselves. We probably have a few more people join us after we start, so we'll just let them in as they come. And so one of our 2021 priorities for mental health was, one of the goal areas was advocating for systemic change and increased services. And so we've invited Erika to come do the presentation on the Marcus Alert Program. You all might have recognized her from her previous role in FAPT on this committee. And so she has gone on to master a whole new area. And so, Erika, would you like to start?
Sure. Do you want me to use my little slides or shall I just chat?
I think slides are beautiful.
Okay, so do I have the ability? Yes, I do. Is it going to let me? Yes, it is going to let me. Excellent. All righty. Okay. Can you guys see? Okay. All right. So what's Marcus Alert? So it's this, and I apologize for folks who already know this, and if this is backing up, but this is the presentation that I've been giving to community members, and so if I am repeating things that you already know, so sorry. So what's Marcus Alert? It's a state legislation that was passed just about a year ago to improve our first responders' interaction with folks who struggle with mental health when they respond to them. And it originally came out of a tragedy. A African-American gentleman he was a teacher actually, who had mental health concerns, and he was having a crisis. And when law enforcement responded to the 911 call, things went very badly, and he ended up being shot and killed. And so through advocacy efforts of his family, we have this legislation in Virginia, and it is working again to improve the responses when folks call 911 in regards to folks struggling with their mental health. And so there's a set of different mandates within that legislation. One of them is that the legislation is going to require localities to collect and report data on the calls where mental health is identified as a factor. And the specific data that they are going to require is still as yet undefined. But one of the pieces is will be related to a leveling system, a standardized leveling system that a state planning commission came up with. And that is, looks like this. So we have these various different levels that the calls will be triaged as they come in to dispatch. And so one of the data points will be that is going to be collected is, you know, what does the call come in as, then what services are referred, what people are dispatched, and then what does the call end as. So so these various different levels, green, yellow, orange, and red, they go from the green being the least and red being the most emergency. And so each different locality is being asked to figure out a plan for how their 911 dispatch is going to respond to each of these calls. And there's, you know, some generalized criteria, but each locality across the state, it's going to be a little different based on what services are available. And so, and with the level 1, those are kind of, you know, just distress callers, people who are looking to talk. These are people who sometimes might just would be often reaching out to what is now called the National Suicide Prevention Lifeline, or what will eventually be 988. They would be directed directly there. And so these calls will now be directed to a crisis call center, which we finally just got our vendor about 3 weeks ago, and our dispatchers have started working with those folks. And the vendor is called PRS Crisis Link for our area. And so our dispatch is working with them on procedures and protocols on how they're going to expedite communication between the two of them, which before taking this job, I had no idea all the complexities of dispatch. But there is a lot of complexities, and we are really lucky because the directors of those units in our 5-county region here are awesome. And so smart, and just have been so great in working through all of this Marcus alert. So then if we look at level 2 is going to be people who eventually, these are the folks that we imagine are going to need to have a response of some sort face-to-face. And eventually, we are hoping that will be a completely mental health response. It'll be a mobile crisis unit going out. In our area, we don't have mobile crisis up fully functional right now. We do have it, mobile crisis team for under 18. So we have child mobile crisis, and it's available about 8 hours a day, 5 days a week. So so that's not full coverage, and we don't have any mobile adult mobile crisis at this point. But eventually, these level 2 calls will not be you know, being responded to by any law enforcement. They'll be completely mental health directed once those mobile crisis teams are up and rolling. Level 3 is so this is where law enforcement is going to be rolling on this, but the hope is that this at this level, a co-response team will be taking the lead. And co-response is you have a mental health clinician who's embedded with the police department going out on those calls. And so currently we have co-response that's been happening in Fauquier and Culpeper through the Fauquier Sheriff's Department, and Justine has also been loaned out or utilized by Warrenton PD as well. And then Culpeper PD has their own person there, and he has gone out on a couple of Culpeper Sheriff calls. That co-response program is expanding, and it's also not only going to be clinical folks, but in order to expand it more rapidly, and what they've found is you don't really need clinical folks in these crisis moments. What you need is, you know, a calm person who's focused on mental health. And so we are going to supply some of the peer recovery specialists that have been working at the C Center, which I'll talk a little bit about too. So they're going to be part of this co-response program as well. So it's pretty exciting. And then the level 4s, that's when the scene, there's something really dangerous happening, and scene safety has to be addressed first before any mental health can be addressed. So, you know, that's, you know, if we have serious medical happening, if there's fire happening, if there's firearms present, if there's a threat to somebody's life. So that means that law enforcement is going to roll. So, so those are the levels that the state has, you know, kind of has required that we begin dispatching based on those levels. And then the other thing that's really important is in relation to our law enforcement within our region is that we have to have increased training for our first responders, and that increased training is crisis intervention training, which is a 40-hour class that law enforcement attends, and they learn a plethora of information. I did it. I did their CIT training. I think it was in the beginning of October that I went through the training with those folks, and it's pretty amazing all that they are learning in that class, and also to see the changes in how they think about mental health from the beginning of the class to the end of the class. It was really probably one of the most transformative moments for me in my short time working on this stuff. And so actually that's one of the reasons that our area probably was awarded the challenge of being one of the pilot sites for Marcus Alert, is because we have currently in our area, we have more than 250 first responders across our 5-county area that have been trained in CIT since December 2015. And our CIT training is, it's very, very highly regarded and well respected across the state. You know, we just recently learned that all CIT is not created equal. And so ours has, you know, been held up as an example. So, and then the last thing, which is where you guys are most important, is the legislation requires each community to have a voluntary information database. And so this is where we really need your help. So the voluntary database, it's a self-reporting tool, and ours is going to be for Culpeper, Fauquier, Madison, Orange, and Rappahannock, the area that our CSB covers. And I really keep stressing this over and over, because when people opt into this voluntary database, it's important for people to realize that that is just coverage in this part of the state. So if a person is in Charlottesville, our voluntary database is inaccessible to Charlottesville. And this is something that people are advocating at the state level, that we expand something so that it's statewide, but it's starting in each CSB community. So, so anyways, it allows folks to share whatever information that they feel is important to share about themselves in relation to, you know, their symptoms, things, their triggers, things that are going to be upsetting to them if a first responder shows up at their home. So you can report as little or as much as you would like. And it's a really good thing for folks to do, you know, before crisis happens, to you know, be thinking about when they're meeting with their therapists or their case managers or whomever, that this is something that they can do proactively to take good care of themselves. And the way that you can access it is through just the CSB website. And once you're there, there's like a bulletin on our CSB website that scrolls through, or you can click through it either way. And then there's one of those is the voluntary information database. And then you click on that and it puts you right into where you can enter all of your information. And so this information is only accessible when somebody calls 911. The dispatchers will be able to search that database, and they can search based on the phone number. They can search based on a name if they have a name. It's searchable based on you know, the names of people you have put in the database. So, you know, like if you put an emergency contact into the database, that's searchable as well. So there's a whole variety of ways that the dispatchers can search through the database to access the information. And again, it's only accessible when a 911 call, when somebody makes a 911 call. So that is the voluntary database, and hopefully you're starting to see these around the county or around the 5-county area. This is a little pamphlet that's out there that a community group created to share information about the voluntary database. So these cards are out in the community. And if you have other ideas of places to put them, or you want some, I can get you some. And then the last thing that I just wanted to touch on is just to make sure that folks know about some of the community resources that are really part and important in this whole Marcus Alert effort. So there's a new peer recovery center in Culpeper. It opened in August. It's called the C Center, and C stands for Support, Encourage, and Empower. And there are currently, I think Corey just told me that there are 19 peer recovery specialists that are covering that over, you know, the 7 days a week that they're open. And so it's a place where folks can just go to get support. There's constantly a variety of different groups and classes. There's AA has a bunch of their meetings there, and NA as well. So it is it's a really great place. And if you're down in Culpeper and you would like to stop by and check it out, Corey Will, who is the program manager there, and Daniel Rammel, who is what's Daniel's official title? I'm going to screw it up, but he's the head peer recovery specialist. So he's in charge of all the peer recovery program. So they are both kind of centered down at the C Center, and they love taking people around, and it's really fantastic. And the other thing is, if you email CSEE recovery at RRCSB.org, you can get on their email list and get the monthly schedule of events that are happening there. And as I said, there's like 4 or 5 groups or classes that happen almost every day. So that's one of the things. And some of the funding that we received to be a pilot program for Marcus went towards getting the C up and running. And then the other things that I mentioned were, the regional mobile crisis services. And so we have child mobile crisis. Adult mobile crisis is going to be getting off the ground in spring is what the regional office is telling me. So more information on that as it rolls out. And then the crisis service line is there, and they keep asking me to make sure to say over and over again to always press that option 7, because that will get you quickly where you need to be. And then we have our crisis intervention assessment center, which is where law enforcement can take folks to have ECOs. And then I talked about CIT training already, and I talked a little bit about the co-response program. But if anybody wanted more information about that, I have contacts of folks that you can be in touch with. So that's my quick and dirty on Marcus Alert, and happy to answer any questions because I tend to just rattle and rattle. So, and I will stop sharing so we can see folks' faces again.
So any